We're getting a closer look at the Biden administration's vaccine mandate. Companies with at least 100 employees have until January 4th to ensure workers are fully vaccinated or offer the option of weekly testing. Booster shots are not part of the requirement, and in many cases, the employer does not need to pay for testing. So this comes as kids ages 5 to 11 start to get their COVID vaccines. Regulators recommended a shot for them earlier this week. President Joe Biden is calling the move, quote, a turning point in our battle against COVID-19. According to the CDC, fully vaccinating 1 million children in that age group could prevent roughly 57,000 cases of COVID-19 and about 200 hospitalizations. So Dr. Dyan Hes is the founder of Gramercy Pediatrics in New York City. She was one of the first pediatricians in the city to administer COVID-19 shots to kids between the ages of 5 and 11, and she joins us now. Listen, I know, doctor, you have been waiting for this to finally happen. You've been getting patients walking in asking when their kids can be vaccinated, and now you're able to administer the shot. What was it like to be able to give out the first few shots to kids ages 5 to 11 yesterday?
It was so exciting. We had CBS News Local there yesterday. It was pandemonium. I realized a couple of things. So many people want it, and so many people are excited. And the office is not that big, and there's such a demand that actually today we're going to have to limit it to one adult, one child, because everybody came with an entourage. They were so excited, the nanny or the grandma and the dad and the mom. And then you have to wait 15 minutes to get after you get your shot, and the office just got so crowded. The kids were so excited. I've never seen so many kids so happy to get a vaccine. They were literally jumping up and down. They were like lifting up their sleeve, pulling it down. You know, they were just ready. I mean, I had one patient last night at 7:30. The mom said she skipped to the office. 7:30 at night.
Wow. To get the shot. Wow. I'm sure that's never happened before for you.
Never.
So it was interesting, too. I watched our CBS News correspondent, Janet Shamlian, filed a piece this morning from Texas where she was, we saw a video of young children getting shots in the arms. And I got to say, the thing that I kept sort of thinking about is how well these kids are able to sit for shots in arms. I mean, I'm not a parent, but it strikes me that maybe I was the only fraidy cat back in the day. Yeah. But I saw a little 5-year-old girl getting a shot in the arm, and there was maybe a little bit of a tear in her eye, but she seemed to be fine with it. Are you working through any kinds of challenges?
Definitely. I mean, there was a few kids who were scared. We have a couple of people that, sometimes it's just harder for the parent to hold them. So we offer that, like one of our nurses might hold them, or the parent actually, sometimes if the parent steps out of the room, it's actually much better. So we'll say, do you want to step out of the room? And we'll just talk to them and we do it. I don't think we had to have a discussion for more than 2 to 3 minutes with any kid who was a little bit nervous. Like, did you get your flu shot? Yeah, this is half, even less than half the size of the flu shot. It's only 0.2 ml. It is such a fast shot to give. So, most of the time, if their child is a little resistant, it's more of the negotiating. Once the shot is done, they're like, that was nothing. Plus, I never give out candy in the office generally, but this time we have candy from Halloween left over, whatever it takes. We have cartoons on, parents are allowed to whip out their phone to show videos. But honestly, it's a mental game. When your parent is so excited for you to get a vaccine, like this is life-changing. We had mothers in puddles of tears yesterday because they were so overwhelmed emotionally that this is going to be a ticket to freedom for their children. Their children, remember, we live in New York City, can't go indoors in a restaurant, can't go into a museum, can't go into the movie theater. This is the library. Your life is going to change when you can go indoors, and winter is coming. So these parents are really eager to get their kids vaccinated. We have no more spots today. I actually can't even give the vaccine tomorrow because I don't have enough staff because I have to see sick children. And we have one challenge in New York State that the American Academy of Pediatrics is really fighting for, is that in New York State, medical assistants are not allowed to give vaccines, where they are in, I think, almost every other state. But for the workforce, most doctors' offices only have medical assistants. So when the medical assistant can't give the vaccine, it has to be the physician or a nurse. And it slows us down because we still have to see our regular scheduled patients. So there are a lot of logistical challenges.
So, doctor, as you know, as we've sort of learned more and more about this virus for adults, there's a recommendation that some get a third booster shot. And there has been talk about, when this virus will move from an epidemic to, something that we sort of deal with the way we deal with the flu. In October, former FDA Commissioner Scott Gottlieb joined Face the Nation, and he spoke on the COVID-19 vaccine being added to the childhood immunization schedule. I want to play what he had to say.
I think it's inevitable that the COVID vaccine is going to be incorporated into the childhood immunization schedule. CDC ultimately has to take that up. My guess is they're not going to take that up until you have fully approved vaccines for children, until you have more than one vaccine in the market available to kids. So that might be more of a fall 2021, 2022 type of event. But you're going to see other states and local districts moving forward with their own mandates. And I think the right locus for decision-making around these mandates is at the local level.
The word I was looking for was endemic, from a pandemic to endemic. But
Right.
So now that we know that more kids are qualified for the COVID vaccine, what's your take on this timeline?
So it's going to really be, like he said, it's going to be much more of a local thing. I can tell you that in New York State, once the vaccine gets FDA approval, it is going to be mandated into the childhood vaccine schedule. And there is going to be a lot of pushback. I'm on all these social media chats with other doctors, physician moms, pediatricians, and it's a very political topic, and it's very state dependent. And you can see that in New York, where the laws and the mandates are stricter, there are more parents moving to get their children vaccinated. But if you live in a country that doesn't, a state that doesn't have a mask mandate, or town or a school district, and your kid is like low risk, there's not really such a huge incentive for you to get the vaccine, because a lot of them are COVID deniers, and a lot of people don't understand how the pandemic is still killing so many millions of people. So it's going to be very political. This is not going away. I anticipate a lot of pushback when it becomes mandated for children. But like I keep on saying, Washington during the revolution mandated the smallpox vaccine for his soldiers, and I don't think they went on social media. They just got it, or they couldn't fight. And then it's called Public Health 101, and sometimes we have to do what's right for our community, not just what's right for us.
So the focus for these vaccines is also then, doctor, likely to shift to children that are younger than 5 years old. Pfizer, as you know, is conducting a trial for kids aged 2 to 4. What do you know about this, and how important is it for this age group to be vaccinated as well?
Well, I think for me, I would love to see this age group vaccinated, because this is the group that I'm seeing that's being born during the pandemic, right? Many of my patients were born during the pandemic, and now it's their year and a half. So these parents are having to train their 2-year-olds how to wear a mask. They rip it off every second. It's a soggy mess. And then I have parents who are so desperate, like mothers who restarted lactating and producing breast milk to give their kids some passive immunity from the vaccine in the breast milk, or mothers who were so excited that they could get vaccinated during their pregnancy that their child will have immunity. These are things that we never had to contemplate before. I really think it's important, because this is going to be the generation of kids going to school. This is going to be the generation of kids who are developing during a pandemic, and we need them to have some sense of normalcy, and we need them to learn to see faces, facial recognition, expressions. I as a pediatrician, see the only pathway to this as having more people vaccinated so we reach herd immunity. And I think that COVID is not going away, and it's going to keep on mutating, and we need these vaccines to keep our kids healthy and in school, daycare, let the parents be able to work.
All right, Dr. Dyan Hes, always great to have you. Good luck getting those vaccines into arms. I know you're not going to be able to do it. You said you're not going to be able to do it today, right? Because
tomorrow. No, today we're packed. Saturday we're packed. Tomorrow we might be taking a hiatus unless we can find somebody to come in to give the vaccines while other of us actually see children. It actually felt like we saw 1,000 kids yesterday. We only saw 45. Because there is so much paperwork. You have to register all of them into your system. It's a lot of work.
Well, the fact, though, that there is all this paperwork and that there are challenges that are specific to New York, but that you still have people that are coming in strong numbers. I think oftentimes the media narrative is that the media narrative tends to focus on the people who are vaccine resistors. But the reality is, in certain parts of the country, you see this, and like I said, Janet Shamlian filed out in Texas, and I think the number, was that some 38,000 kids have already been vaccinated in the state of Texas, which is a huge number. And I think that a lot of the parents that she spoke to, she basically, I don't know if you saw this, Dr. Hes, but in the parents that she interviewed, some of them were highly emotional so grateful that their children could finally receive this vaccine. I don't know if you've seen a little bit of that too.
Yeah.
She said
we had a lot
she
of
did.
tears
She saw
yesterday.
parents crying.
We had tears. Parents were crying. Mothers were like, "This is your ticket to freedom." And it was a great day. I said the first day I ever worked, giving the vaccine in Hillcrest High School in Jamaica, Queens, was probably one of my best days in medicine. And second, yesterday was. It was a great day.
Wow. Fun fact.
And there are people driving in from other states to come and get this vaccine. I mean, the rollout is not going as planned, but we're going to give as many as we can. They keep on coming. We'll keep on giving them.
That is great. That is great. And a fun fact, I was born in Hillcrest General Hospital in Jamaica, Queens.
Oh, my gosh.
Which I think has changed its name now.
It's a great place. It's a great community there. Yeah.
Thank you, Dr. Hes. Appreciate it as always.
Take care.